and thank you very much for Rachael Powell. So that's who I'm introducing next, who's Deputy Director of Information at NWIS, which is soon to change its name, but NWIS for now. And Rachael's going to pick up on some of that area of work that Karis talked about, the digital space and what that really means for the future of research delivery. So welcome, Rachael, and thank you.
Thank you, Nikki. We're actually DHCW now, so NWIS is no more. So, afternoon everyone. I'm Rachael Powell, the Deputy Director of Information for Digital Health and Care Wales. Thanks for inviting me to talk to you about the newly formed DHCW and the future of research within Wales, or more specifically, DHCW's role in supporting and developing the research landscape within Wales. Just a really quick intro to myself. I actually joined the Information Services team in September of last year in the middle of the pandemic. I've yet to physically meet any of my team, ironically. And prior to that, I had roles within WAST, ABMU Health Board, as it was called back when I worked there, and Informing Healthcare, which was one of the predecessor organisations to DHCW and NWIS. I also worked in various healthcare organisations in the northeast of England, which is where I'm from, and I'm just going to get that out the way early doors so that you're not trying to suss out the origins of where I'm from a weird accent. And I also promise I'll try and talk a bit slower as well. I'm just conscious, Nikki, that it says my session's paused on my clicker, so I can't move the slide on, but I'm happy to say next slide, please, if that's easier, just to keep it going.
Yeah, one of the team can move your slides on, no problem.
Brilliant. I'll be like Chris Whitty then. Oh, brilliant. Thank you. And it's come up on my clicker as well. So hopefully most of you will be familiar with our predecessor organisation, NWIS, which was hosted by Velindre NHS Trust for 10 years. And what that essentially meant was that we utilised the governance arrangements within Velindre to oversee our business. Under that arrangement, however, there were limitations in terms of what we could do, and an example was that we were considered an arm's length producer of statistics, and we couldn't publish as much as we would have liked to under our own auspices. Consultation responses prior to the formal establishment of DHCW acknowledged that as a special health authority, it would facilitate increased health intelligence, opportunities for research, development and innovation, and the increased ability to publish stats and data sets. It also affords us our own legal status, a more sustainable funding model, and actually some equity in terms of what our Four Nations counterparts have already got in place. So on the 1st of April, a few weeks ago, we officially became a Special Health Authority, Digital Health and Care Wales. We need a nice way of summarising that. It feels like a bit of a mouthful at the minute. And we've got our own board and a new governance structure. And with that, greater visibility and accountability into how we operate and deliver our plans. We've just recruited our independent members, including our chair, Bob Hudson, which I'm sure a lot of you'll be familiar with. We've also appointed our medical director, Rydian Hurl, and our director of finance, Claire Osmondston-Little. Over the course of the next few months, we'll hopefully have a substantive chief executive, with Helen Thomas currently acting into that role, and 2 other executive director positions on the board. We're also now an official statistics body under the official stats order, so we can now directly publish more of the data that we're used to handling, linking and analysing, so watch this space. A further benefit of the new organisation is that given our new digital status, we're in a far greater position to not only support the research environment within Wales through the provision of data, but as data and digital experts, we can contribute far more to developing and delivering research ourselves or alongside partners. And that's something that I've been exploring recently, particularly with the Healthcare Research Wales team, to ensure, and just picking up from previous presentations, that research isn't a nice to do when we've got the time to do it, but actually that we've got a dedicated function who are actively working in that space. So with regards to DHCW, as I say, it's very early days, but we're 3 weeks in and so far so good. I'll just move to the next slide. Worked. So I wanted to briefly mention my own area within DHCW, information services, and to give colleagues an idea of what we currently do and to set out what's available, particularly in terms of how we could and do already support research within Wales. The Information Services Directorate constitutes 40 plus information professionals with the collective responsibility for data collection or acquisition, storage and warehousing, processing and linking of data sets. And as you can imagine, the data varies massively in terms of its structure, size, frequency and volume. And then finally, analysis and reporting of mandated All Wales data flows for costing, performance management, official stats and service improvement. We also produce a range of data products depending on our customers, ranging from dashboards, health maps, portals and web apps, to name a few. The DHCW warehouse holds over 30 years of healthcare data sets, including secondary care, maternity, births, deaths, child health, cancer, Welsh ambulance, patient reported outcome measures and demographics, and more recently, a lot of COVID information. A significant turning point for us was actually COVID, and I think that probably stands true for most of us on the call today. But from a data perspective, it actually did us a huge favour. Scenarios that would have previously taken months, if not years, to satisfy governance requirements and stakeholder engagement, we found that we were fast tracking so much of this, and actually there was an expectation that we did so. That's not to say that we ever became complacent, but rather access to timely information became a necessary and vital component of a pandemic response. And I'm really proud of a team who threw themselves into developing shielded patient lists and risk stratification methodologies, daily reports on infection rates, mortality and ITU bed occupancy, cohort identification for the vaccination immunisation systems, to name but a few. And almost overnight, we're transformed from a Monday to Friday secondary uses reporting service to a 24/7 cancel or leave mission critical team. So it's really put us on the map. But I suppose most importantly, our take home lesson from all of this is that we must not revert back to how it was, and us grappling with ensuring we could access the data we needed to in the midst of a pandemic. Arguably, the data should have already been there and ready for us to use as appropriate. And I know that sentiment's been echoed throughout other sessions as well. And that brings me neatly to the National Data Resource Programme. A Healthier Wales, our plan for health and social care, set out the need to establish a national data resource which allows large-scale information to be shared securely and used appropriately. The vision of the NDR is to support NHS Wales to be innovative and modern and to use data to drive decisions that will improve patient experience and service outcomes. It'll push boundaries in terms of big data capabilities and will create faster, easier access to data. It's an ambitious programme and there's some real challenges ahead to design the optimal technical architecture as well as navigating the inevitable governance challenges that they're going to face. The NDR also has established an advanced analytics group in order to support research, escalate challenges, showcase innovation and nurture academic partnerships. There's a number of themed areas that the advanced analytics groups is looking to support, including natural language processing, chatbots, advanced image processing and analysis, population health and behaviours, prediction and planning. And then underpinning all of those themes, identifying and enabling the use of analytics tools and analytics capabilities. From a research perspective, NDR promises a lot to the future of research within Wales. And I thought it was also pertinent to mention SAIL, which I'm sure you're already very familiar with, but certainly worth repeating. SAIL continues to support research through its secure storage and use of anonymised person-based data for research. Digital Health and Care Wales now. We've got a well-established relationship with SAIL and act as a trusted third party for Swans University. So where DHCW provide the linkage and anonymisation of data for the SAIL data bank. We also regularly review the data sets that we share with SAIL and we'll look to make more data available where possible. And as recent as yesterday, myself and a colleague had a meeting with a researcher who was looking to do some research around common ailments. We were looking at providing potentially pharmacy data sets into the sale data bank and looking to facilitate how we can make that happen. So constantly looking at how we can support data to support research, provide data to support research. It's also worth noting that DHCW is working towards accreditation under the Digital Economy Act, and that's not to be confused with the Drug Enforcement Agency. I work in an organisation that's made an industry out of acronyms, and I'm really struggling to keep up. I think someone challenged me in a meeting recently and said, what is DAA accreditation? I was like, don't say Drug Enforcement Agency, don't say Drug Enforcement Agency. So no, it's absolutely the Digital Economy Act. Yeah, and the scope of the accreditation covers the process from transfer of data to the appliance, creating the linkage, formatting the data, and project creation within the appliance as well. It's also intended to provide assurance of the responsibilities of the DHCW team on the administration of projects, including the amendment and decommission of projects. So, you know, we're very official within DHCW. And then finally, I wanted to end my presentation just recognising some of the good work of my team recently, but also just to give a flavour of some of the work that we've been involved with recently. And it really is just a snapshot, but hopefully gives some ideas on the scope and breadth of things we can get involved with or have been involved with. So the role of the DHCW value-based healthcare team is to give health boards the mechanism to implement value-based healthcare within their own organisations. Initially, this has been achieved by designing a series of dashboards on different clinical areas, which bring together data from a wide range of data sources and presenting the data in a meaningful way. The purpose of the VBHC programme, and it really does do what it says on the tin, it's to improve the health outcomes of the people in Wales in both a financially and patient value centred way. So far, we've produced dashboards for heart failure, knee arthroplasty, lung cancer and myeloma, and we're working with teams to constantly develop and expand these and to also add more dashboards to the portfolio. Another example the team were involved with was the AMBER review in 2018, which was essentially a review of the AMBER ambulance 999 calls which were undertaken, and it required data linkage across data sets from both the Welsh Ambulance Service and major emergency departments. There were many issues involved in the linkage, not least because one of the limitations of the patient clinical records were that the information was handwritten onto paper forms and wasn't actually linked with the CAD data within WAST. So the team worked really hard to create a data linkage process with a high degree of accuracy and ultimately and linked it to the secondary care data within the AD departments and ultimately helped to provide assurance on the appropriateness of the clinical response model utilised by WAST. And I just wanted to give a quick nod to my colleagues within WAST because I know that they do a lot to support the current patient clinical record system, and more recently their efforts have been rewarded and they're developing the plan to implement an EPCR, and they've had the business case approved by Welsh Government, so that's really positive. And then finally, a more recent example is the COVID-19 Data Hub, which was born early in the pandemic and has grown significantly in terms of the data that we provide. Ironically, I think a key member of our team contracting COVID in the early part of last year and isolating himself in a back bedroom and working on it solidly for a number of weeks probably helped its development. But its purpose was simple: to provide operational teams with up-to-date live data on all elements concerned with the COVID-19 pandemic. More recently, we've been linking to a Welsh immunisation system, and we've been providing colleagues around NHS Wales with views on the total number of vaccinated and unvaccinated cohorts. And anecdotally, we know a number of senior NHS leaders in Wales have this on a screen and constant view, and it's probably why we're being requested to refresh the data several times throughout the day as well. I don't want to profess that any of us have been plain sailing or that we haven't made mistakes and learned lessons along the way. We're also very aware that some of the technology and equipment we rely heavily on needs to be updated, and we're working closely with NDR colleagues to try and work up longer term solutions for data acquisition, storage and analytics. But I do strongly believe that the availability of data and the commitment from data teams across Wales has enabled quick decision making and for responsive plans to be put in place. So hopefully that was a useful overview, firstly to introduce our new organisation DHCW, but also to set out some of our commitments to support and grow research within Wales. I'm happy at this point to take any questions as part of the session, or I'm equally happy to be contacted directly if you had a specific question, or if you wanted to have a longer discussion with myself and members of my team, and I've included my email address as part of the presentation. So would welcome any contacts from colleagues after the session. Thank you.
Thanks very much, Rachel. That's great to hear of the new organisation and its ambitions and vision, and some examples there of some of the great work that you've been doing over the past year. And you know, and while people think of specific questions, if there are any for you, I suppose one question that reflects some of the work we have been doing over the last year on the ability to both link but also to have access to data by people under the COPI regulations, which are obviously relax the ability to access data in an emergency situation to support people's care, and that's been critical for some of the delivery of some of the trials. So as I know COPI's been extended, but as we emerge out of the pandemic and we think about the benefits that some of that has had for the delivery of research, what do you think will be the post-COPI world of data access? And of course, with that is data linkage.
Yeah, it's a really good question. It's something that we've been talking about at length within teams, because we really appreciate that COPI's given us permission to do a lot more throughout the pandemic, and rightly so. But just going back to the point that I made, we don't really want to revert back to how it was, and to forego some of the access that we've got now, and the ability to do things a lot more agilely, still within the constraints. We need to be safe and secure with where authorities and handle things securely. But I think being a new special health authority certainly puts us in a preferential position. Previously, we were simply a data processor, processing data on behalf of the various organisations whose data we looked after. We're now our own legal organisation, and we'll be looking to become a data controller of some of those data sets as well. So we've got a bit more authority and permission in that field. And I think from a Welsh Government perspective as well, working closely with policy leads to get more direction from there in terms of, if there's specific projects that we want to engage with some of this could be handled in a way by which we get the directive from Welsh Government, and we can use the data, as per. So I think there's a lot in consideration at the minute, and I think a lot of people are grappling with that very problem and thinking, what can we do post COPI? But it's a really good point.
Yeah, and of course regulations, although people might not be aware, are driven by a lot of work around public attitudes and what do people want to be accessible or not, or protected in terms of the use of their data within health and social care. So can you say a little bit about the work which we'd been talking about earlier that's going on behind the scenes in terms of, driving those future regulations or changes to them?
Yeah, so again, I know we're aware of some important research that's going. I think ONS have just commissioned a big programme of work looking into what the perfect formula is for ensuring readily, easily access to information without the constraints of some of the more rigorous governance controls and all the things that entails further down the line. So I think that they were trying to commission something that would try and find the perfect formula so that you could anonymize or do enable access to certain data sets, and it would exclude some of the governance blockers, if you like, that traditionally get in the way. But I do think anecdotally, and it is anecdotal, that attitudes are changing. I think conversations that I'm having in different forums and group, the expectation is very much around, as long as you can satisfy that you're holding it safely and securely, just get on and do what you need to do. And there does need, that's not to say just open access to everything and not have any controls. And I think there is a perfect balance somewhere that we need to work out. But I think, anecdotally, I think that COVID has done us some favours in that respect, and people people have learned that actually having that data available and readily available to use for how we respond in a pandemic was absolutely vital.
Yeah, lovely. Thank you so much, Rachel.
No
really
problem.
Useful to have an update on the things that are going to impact us for the future in trying to deliver research in a more agile way, as well as the data aspects of that. So thanks very much.